everybody involved with this. All right, so now we're going to do the pelvic girdle and the lower limb. It's not as bad as the upper limb. So here we go. Hopefully you have out in front of you. Let's just take a couple of minutes to make sure you have that. So we need these two guys, right? So we need the two hip bones. If you want to, perfect. If you have the sacrum there as well, that would be good too, because we're going to put the whole hip bone region together. And then what do we have? We need the femur, tibia, fibula, and the patella. We've got 1 foot, I think, going on, and that's it. A couple of things over there on the counters. Make sure that you go up and take a look at those two hip bones. So we have male and female. You can figure out, oh yeah, so exciting. So you can see what the differences are between those two. And you can actually see in kind of like the cross-sectional view of the femurs, you could see that medullary cavity that we're talking about in lecture today. All right, so let's start with the pelvic girdle. And here we have the two hip bones. Don't forget that dorsally or posteriorly, they're connected to each other via the what? Via the sacrum. And up in front, the two of them articulate to each other via this interpubic disc. Remember, between the bodies of vertebrae, we have what? Intervertebral discs, right? They're cartilage. Intervertebral discs. What kind of cartilage? Fibrocartilage. Fibrocartilage number discs, right? All right. So now we're going to look at each individual hip bone one at a time. And here's a good one to look at. So, and again, I always have the real ones on my card, so look at those as well. So, each hip bone, which is also called the coxal bone or the os coxae, I can't spell that, so we'll just call it hip bone. So the three parts of the hip bone would be the ilium, towards about the ischium, and up in front the pubic bone. Ilium, ischium, and the pubis. Couple of things, and again, perfect. Always look at the fully articulated skeleton to see what's what. But in order to kind of orient this bone, on the ilium, kind of facing medially and posteriorly, find kind of this rough region, and this is called the auricular surface, exactly right. So the auricular surface of the ilium, right here, that's the surface that faces and connects to the sacrum. So if I could borrow your sacrum. So we got the sacrum in the back here, all right? And then anteriorly, the two hip bones articulate to each other. Now go ahead and grab your ischium. Well, not first, but the bottom. Grab your ischium right here, that's in the back, and find a big bump. Find a big bump on the ischium, right here, big bump. This is called the ischial tuberosity. Why is that important? Well, as we speak, I'm standing, you guys are sitting, you are sitting on your ischial tuberosity, right? Ischial tuberosity, that's called the sits bone sometimes, right? So when you have a hip bone, you don't know if it's right or left, what's going on, what are you going to do? What do you call this big bump? Ischial tuberosity, and you're doing what? You're sitting on it. Whereas the rough region is in the back, and it articulates to the sacrum. Okay, so that's the orientation. Also, please find this deep cavity, right? The big socket. See the big socket right here? What do you call the socket? It's the acetabulum. Let's go to the other slide. All right, so on the other slide, you're looking at this deep socket. So this is a ball and socket joint, right? It articulates to the head of the femur, acetabulum. And then which way does the acetabulum face? Medial or laterally? Lateral, right? Because it's going to pick up the head of the femur. Finally, the pubic bone faces anteriorly to articulate to the other hip bone. All right, so let's go to the first slide one more time. Question, ilium, ischium, and pubis. Why have the three parts to it? Or here's a better question. Why do we have the three different colors? So this is kind of like a beigey thing. We've got the kind of pinky thing and green over here. In a developing human, the three parts, ilium, ischium, and pubis, are originally not connected to each other. There's cartilage that unites these three pieces of the bone. In other words, developmentally speaking, each hip bone starts out as three bones, which are, one more time, the what? Ilium, you sit on your what? Ischium, and up in front is the pubic bone. And they're separated by what kind of cartilage? If in doubt, starts with an H, you go with hyaline cartilage. That's your growth plate, right? And at one point, when the cartilage goes away, you've got bone to bone, then you have a completely formed hip bone. By the way, at what age do you think each of the two hip bones is completely formed? Ossified, one bone. 25 through 30. So it's later than you think it is, exactly right. So you all might still be ossified. Anyway, back to the ilium. If you look at the ilium, we've got the iliac crest. We have an iliac fossa. What does fossa mean? Basin-like shallow depression, right? Could anybody name a muscle that in life is situated within the iliac fossa? Make one up. Iliacus muscle. Iliacus, it's one of the sit-up muscles, right? Iliacus, that's for later. Then can you see how the ilium on either side ends up with 1, 2, 3, 4 projections? These are called the iliac spines. So way up here, and this is usually the more palpable, and I've got a lot of padding, I can still feel my anterior superior iliac spine to palpate some of these things on you. If this is anterior superior, what would you call this one down here? Anterior inferior iliac spine. The last two words are always iliac spine. And then back here, what would you call this one? So it's posterior superior iliac spine, and that would be the posterior inferior iliac spine. We've got the 4 spines. Again, for the sake of orientation, like which way is what, because it's kind of a weird one. If you find the anterior superior iliac spine, you know it's anterior and superior, right? You're sitting on the what? Ischial tuberosity. Up in front is the pubic bone. What do you call this deep cavity? The socket is the acetabulum, right? So you have a sense of orientation. Also, don't forget this rough region in the back, which is called the auricular surface, articulates to the sacrum. Auricular surface to the sacrum, anterior superior iliac spine, the most prominent. You sit on the ischial tuberosity, and the 2 hip bones articulate anteriorly through the pubic bone. Okay? So what else do we have on the ilium? Pretty much covered everything. Now we move to the ischium or ischium. Most people say like ischium. So again, you're sitting on the ischial tuberosity, right? Then you'll find one spine, and this is called the ischial spine or ischial spine. Look at the spine, keep looking at that one, and then on either side of the spine, you're going to see a notch. Here's the bigger, greater sciatic notch, and here's a smaller, lesser sciatic notch. When you look at the actual specimens over there, you'll note that it's kind of like a darker beigey thing. Those would be ligaments, non-bone things. In life, all of these regions are kind of closed up by ligaments. Greater and lesser sciatic notch. Take a wild guess. Which nerve might be going through these greater and lesser sciatic notches? Sciatic nerve. It's the biggest nerve in the body, right? Why is this information really important for you guys to know? That the sciatic nerve is present there. It's fairly superficial. For you as future healthcare professionals, why is this important to know? What if you're going to administer a shot in your patient's butt region, right? Intramuscular shot. You need to know where you place that needle because it's going to be placed way above this area where the sciatic nerve might be going through, right? So the placement is usually way up here into the gluteus medius muscle. Oh, you don't want to be placed right here. Nowhere near this region right here. What is that called? A lawsuit, right? Because what if you hit that sciatic nerve, right? Has anybody ever had sciatica pain? Oh, I had it. It's awful. When I was pregnant with my son, he was 10 pounds at birth. I keep reminding him. But anyway, he was sitting on my sciatic nerve. I know, right? Towards the end of pregnancy, I could barely walk because he was just compressing that sciatic nerve. So after he popped out, it took another 3 or 4 months until the pain was no longer there. So sciatic nerve is a huge nerve. It's the size of the thickness of your thumb. It's really, really large. When we have a chance to do so, I'll try to show it to you on the cadavers, okay? So one more time on the ischium. What do you call the bum, please? Ischial tuberosity. What do you call the spine? Ischial spine. And don't forget the notches. This would be the greater, and this would be the lesser sciatic notches. And then finally on the pubic bone, it's got a little tubercle and a crust. But here's the important thing. See, it has these 2 branches, like a sideways V, and these branches are called rami. So you have Rama's branch. So you have a superior ramus and an inferior ramus of the pubic bone. Here's another question, a lot practical or something. If I have a question, what articulates right here to the pubic bone? The answer is the other pubic bone, right? That's called the pubic symphysis. All right, now, as far as right or left hip bones, am I going to ask you right or left? Oh, yes. How do you know right or left? Well, God, I forgot to talk about this pole. Okay, so, how do you know right or left? Well, visually, you can't pick anything, right? Kind of sitting on your ischial tuberosity, right? This rough region is facing posteriorly. By the way, this big hole is called the obturator foramen, big hole, which in life is mostly closed off by muscles and a membrane. Some blood vessels and veins go through. So, sit on the ischial tuberosity. The acetabulum faces laterally, picks up the head of the femur, exactly right, and then the pubic bone is up in front. If it's on the left, it's the left. If it's on the right, perfect, you got it. Not too bad.
It helps
right?
you too.
Try it out. See, right or left?
Right.
Honestly, all I remember is this thing is just outward.
And this goes back.
Yeah.
Yeah. So this goes back.
Oh, yeah.
Yeah.
So you know that this connects to this little back part.
Right here.
Yeah, so then no matter which way she puts it down, you can kind of figure out which way that fits in. Yeah, and there's like two big holes.
Should be like this. Do these connect?
They
They
do, yeah.
touch? Okay.
Okay, so now, ooh, yeah, okay. That's heavy, right? Okay. So, that's a real one, you can pass it around. Look for nutrient trainer. All right, so let's pick up the femur. Ooh, that's perfect. Yes. Perfect. I'll come around and help everybody. All right, so let's get a femur out.
Like an axe murderer.
This is like right from
head when I'm studying, that is
Yeah.
what the femur is.
The femur is the weapon of choice.
So on the femur, let's go ahead and get this done, folks. All right, so on the femur, where's the head of the femur? Boom, here it is. And it articulates to the what, please? To the acetabulum, right?
Yes.
That's your hip joint. Then can you find a little dip on the head?
Neck.
Oh, that's correct. Oh, okay. What do you call this little dip?
Oh.
Little dip. It's called the fovea capitis. So the fovea capitis. Right over there. All right. Then find the big bumps. We got a big bump here, kind of higher up. Small one there. These are trophanters. Not cool. You could kind of see some of the spongy bone coming through right here. But you could, on the, that's a real one. Look on the, over here, if you see this little opening for the blood vessels, should be in there. Okay, so we've got the greater and lesser trochanter. Then if you look carefully up in front, it's nice and smooth. Smooth in the front, that's cool. But if you look at the back, look at the posterior, the back of the femur. You should be able to see a sharp line. See the sharp line? Did I steal it from you or something? Sharp line is posterior. And it's called the linea aspera.
So this is the posterior.
Linea aspera.
This is posterior and anterior.
All right. And
feels
then,
about the
if
same.
you look most distally,
Do you want to see this?
all the way down here.
This is root.
Isn't that cool? That pass around, it's so cool. It's really, look at it for all the little holes and stuff. We have the two condyles, medial lateral condyles, and we have the epicondyles on top of them. Okay, so we've got the lateral condyle, medial condyle, epicondyles on top of them. Please now find on the front a smooth patellar surface. Bam, right here. Patellar surface is in the front, right? Patellar surface. And of course, it's a patella that moves or glides over the patellar surface of the femur. Okay, right or left femur? What's the right, Chuck? Is it right or left?
Also, to remember is like it's gonna bend this way, right? Like it'll make like if it was this way, that would be the back.
Yeah. Okay.
Yeah.
Well, that's good to know that.
Yeah.
Well, I just know this is the front.
Yeah.
And like these little knuckles just like poke inwards.
Yeah, and if those are on the outside, that makes sense.
Yeah.
Okay.
Because she might have tried to trick us a little bit by like switching it up.
I think it helps also to know where like the patella goes, because we know that if you flip it, like you can't really, it's not, you will fall in.
Right.
You know?
Right.
Yeah, so that's good.
Are the midterms like on lectures or lecture and like
There's
what we learn in lab?
There's two. There's like two types of exams. There's the lecture exams, and then there's the lab exam.
Oh yeah, it's like I know the lab practical is more like obviously like this just the stuff.
It's
we
this
learn.
stuff, yeah.
But it's like the midterm, the final.
That's gonna be like what we did on our. I think that there's for both. Like I said, there's lecture and lab. Yeah.
Like sometimes teachers do lectures and lab and like the final do the big test.
Yeah.
Wait, what? I'm sorry.
So like it's not cumulative either, which is good. So like chapter 1 through whatever that we've been covering, and luckily like she gives us time. Like she's not completely loading us with information that's gonna be.
Oh, that's what
amazing.
you mean. Okay, yeah. Yeah, I did notice that. I was like, oh, it's broken up into certain ones. So
Yeah.
we're only doing that, and then only doing that.
I like it.
Yeah, it's a little bit better. The only thing that I saw that was like a little like annoying, just for me personally, we go on spring break right after we've learned a bunch of things, and then we have one more thing, and then we have to test for that. So I was like, that's weird.
Well, you just study, I guess.
I think the stuff
Yeah.
after spring break is like the same chapter as the one we learned.
Yeah, it is. It's part of it, definitely. But yeah, I'm definitely gonna have to like go over things on break. Yeah.
I have like jury duty on spring break, so I can't do that.
Oh, really?
What is that one? I have jury duty too.
You have jury duty? It was gonna be like during the school week, but I'm like, no.
I postponed mine because it was like middle of the semester last semester. And I postponed it to the week before Christmas. Nobody shows up. No, the week before before. They never told me.
I think we'll be okay, honestly, though. Like, I don't think they're gonna actually call me.
Because if they call you in, or the excuses, no excuses, the legit things, they cannot.
Oh, really?
They will make teachers come in, but not students.
Oh, I didn't know that.
Oh,
I thought like they'd make you in unless you had something you couldn't make up.
Well, you know, it depends. If it's like a 2-month trial, you would be able to stay in the class. And that would
That's
compromise.
true.
They tell compromises financially or whatever else. Your career plan.
Noted.
So I told her mom, and she was like, "Oh, don't worry. I think they'll like let you postpone it because." And I still, you know nothing about the drill.
Yeah.
All right, so now on the patella.
So cute. Yes, like a little like girl top and it like kind of moves.
The voice was like, why does this little thing here and like the rest of it?
I'm out of here.
Same.
She's like, I feel this, and like there's this huge chunk.
Patella.
Yeah.
Let's do the patella. Nobody's listening to me. I'll tell you guys. You are. Apex. Wait, so
I
we're
think it goes that way.
the grades to the right.
I think I'm probably gonna know what's the left and the right.
Are they the same?
Go like that.
Yeah. I just don't know if this is the left or the right. The little part that goes down, the point goes down.
No, they're definitely the ones left and right.
Yeah.
Like I'm not sure if you can see it, but like there's one edge that goes like a little smoother and then yeah.
Can't tell which one is which.
I just gotta figure out which one's left and then we're good.
How do we know which one is left and right?
Take the little apex part, little pointy thing, and you point it away from you. So if you were trying to figure out, and on the lab practical, you can't touch anything, but I'll put it just like this.
Okay.
See how it leans to the left. It's not going to go right, goes left.
Okay. So,
So
Wait,
that's
away
the
from
left
it.
one,
So it goes to the right.
and so
So
that's the
it's-
right
oh,
one.
okay.
What if you put it upside down? You should put it upside down.
Wait, I don't understand. Okay, so,
So just like put the apex away from you.
okay. So this is the left.
Yeah.
Yeah. Whichever side it leans to.
Okay.
I guess like your right and left as well.
Like this? Or this one?
That's the left or the right?
This is the left.
So that goes over
This
here.
one?
Okay.
Oh yeah, the little, you see how there's like a little indent? It like goes onto this part here.
Okay. It looks like a shape of rock in real life, but like you look at the picture, it looks like a cute little seashell. And that's like the only thing I really have trouble with. Like in the picture it looks perfect. But when you look at the real thing,
It looks different, yeah.
well, like, so let's say like this left, right? I can kind of feel like this side is bigger, like from this like ridge, this ridge. This side's bigger. That one, the left.
That one's the left.
It's the left. It's like bigger. It's like the opposite. The side that's bigger on is like. So this side's bigger on the right. And this should be the left. Honestly, I'm just like waiting for the lecture or like the lab lecture to be over. Just like, I don't want to miss it.
I am here, and please find a big bump called the what, please? Tibial tuberosity. Can you feel your tibial tuberosity? Uh-huh. Yes, you can. It's immediately distal to the patella. Feel that bump? That's the tibial tuberosity. But way up here, go way up here, you can see these two little bumps, intercondylar eminence. This is going to be important once we talk about the knee joint. And then we have the two condyles. The next thing is really important. As far as the knee joint is concerned, when you look at the distal femur, remember we've got condyles here, right, on the femur, and the femoral condyles articulate to the condyles of the tibia. Lab practical question, you all ready? Here's a question. So I'll give you a femur, well, American femur. So I'll give you this bone, I have a sticker right here. Here's my sticker, right here, you all ready? The question is, what articulates here? Don't overthink it. So, medial condyle of the tibia. So this is the medial condyle of the femur and articulates to the what? Medial condyle of the tibia. This would be the lateral condyle of the femur, articulates to the what? Lateral condyle of the tibia. Condyles to condyles, right? Then back to the tough tibia. Please remember that the bone is medial, right? We've got, I kept talking about this anterior crest or border and the shin splints thing, right? So this would be anterior border or crest. You could feel it on the anterior. It's very, very superficial, right? So, and that's an area of injury, especially in athletes, especially in runners. Then we have, still up here, we have the little skinny fibula. On the fibula, this is important. I'll tell you exactly what I'm going to ask. On the fibula, first of all, I want you to know that it's the fibula. That's pretty easy, right? So it's the fibula. I want you to be able to differentiate between the two ends. We've got the two ends, right? The proximal end is the head, it's more rounded. The distal end is more elongated. This side. Proximal end is kind of rounded, more rounded, and the distal end is more elongated, right? And lastly, on the fibula, please write this down or remember it. On the fibula, I will not ask you right or left. That's a lie, right? On the fibula, I'll ask you the following. Bone is the fibula, proximal end is rounded, the distal end is elongated, and the distal end is also called the what, please? Lateral malleolus, which means like a little mallet, like a little, yeah, you're going like that, like a little mallet, right? Okay, so the medial and lateral malleoli, I'm not going to take my shoes off, but you know those bumps on your distal ankle, those big bumps, those are your malleoli, right? You know what I'm talking about, right? So the medial malleolus is part of which bone? The tough tibia, right? And the lateral malleolus is part of what? The distal fibula, right? Let's go back to the distal antebrachium. What do you call these little bumps? The very end of both the radius and the ulna. These are the styloid processes, right? Medial lateral styloid processes. Distal ankle, not styloid, but what? Malleoli. Which one is medial, tibia or fibula? Tibia, exactly right. The tough tibia is medial. Why is the big tibia medial, not lateral? It picks up most of the weight, right? The fibula is more like a muscle attachment. All right, and then finally on the foot, on the foot. This is on the foot, okay. Now we're going to compare and contrast the feet and the hands, right? So, back to the hands. Remind me, what do you call the wrist bones, please? Carpals. How many carpals are there per wrist? 8. We're going to name them again. Boat, scaphoid, moon, lunate, the triangular, whatever, easy. Okay, what's my favorite, please? Pisiform, right? On the thumb is the what? Trapeze. Next to it, trapezoid, big head. Capitated got the hook. Hamate. One more time. Boat, scaphoid. Remember, it's romantic. You're sitting in a boat, scaphoid. You're looking at the moon. Then nobody could say that. Triquetrum. My favorite is the pisiform. On the thumb is the trapeze. Next to it, trapezoid. The big head. Capitated got the hook. Hamate. Okay. But on the feet, we have not carpal bones, but what, please? Tarsal bones. Think of toes tarsals. If we've got 8 carpal bones per wrist, how many tarsal bones do we have per foot? Did you count this morning? 7. 7 is good, right? So there's 7 of them, right? So the heel bone is the calcaneus. Then you go right in front of it is the talus or talus. Forget what that means. In front of the talus is, here's another boat thing again, kind of elongated, navicular. One more time, heel bone, calcaneus. That's where the calcaneal or Achilles tendon attaches, a big tendon in the back. Okay, so the heel bone is the calcaneus. This will be the talus. What does that mean? I have to look at it. In front of it would be the elongated boat, navicular. And then distally, all these 4 distal bones have names that begin with a C. The biggest one is the cuboid. You know what's goofy? All of these have the same name. I guess they got bored. Once they get to the foot, I ran out of names. And they're all called cuneiforms, which means wedge-shaped. So we've got medial, cuneiform, intermediate, cuneiform, and lateral cuneiform, okay? So we've got the heel bone is what, please? Calcaneus, and then we have the talus. In front of it is a boat. And then we've got the medial cuneiform, intermediate cuneiform, lateral cuneiform, and the biggest one is the cuboid. Or you could say like this: tiger, cubs need milk. Tiger, cubs need misspelled milk. Okay? Right? Remember for the carpals, I gave you one too, right? All right, so on the foot and on the hands, I promised to place them in anatomical position. Okay, both the hands and the feet. So back to the hands. We've got the 8 carpal bones, and then these middle ones are called the carpals, not metatarsal, that's toes, right? And by convention, the first digit is a pollex. So first metacarpal, third, fourth, and fifth, and whatever. On the foot, we have not metacarpals, but metatarsals. Think of toes, right? Perfect. And so again, the hallux, or the big toe, is the first digit. Midterm question. The hallux is what to its fifth digit? Medial, right? Whereas the fifth digit of the foot is what to the hallux? Lateral. One more time. Hallux is medial to its fifth digit, or the fifth digit is lateral to the hallux. Pollex is what to its fifth digit? Lateral, because this is not anatomical position, this is, right? So the pollex is lateral to its fifth digit, or the fifth digit is medial to it. Yes, you had a question. Yes.
Could you repeat the question one more time? Like how you're doing it?
Oh, the question for like the medial lateral? Okay, so this is for the midterm. The midterm, by the way, for the lecture, it's the online thing, 50 questions. That's it. You have an hour for 50 questions, multiple choice, and there's 2 points per correct answer. Okay? As soon as you finish taking the midterm, it'll be online. You'll have your scores right away. But then you won't know which ones you got right or wrong till later on in the day, because I want to make sure everybody's completed it, okay? Just the hardest part about the midterm is to make sure to remember to take it. And I'll send an announcement earlier on, so easy peasy. So for the midterm, everything is multiple choice. You don't write in anything, right? So, what did I say? Okay, so the hallux is what to its fifth digit? Medial, because hallux is, do we have one here? So, it's medial to its fifth digit, right? But what do you call the thumb? The pollex is lateral to its fifth digit, right? Here's another question. Fill in the blank, please. It'll be multiple choice, right? So the olecranon region is what to the antecubital region? Olecranon region, posterior or dorsal, right? Or antecubital region is what to the olecranon region? Give me 2 answers, please. Anterior or ventral. The cervical region is what to the umbilical region? Ooh. Superior to the, and how about 2 other words for superior? Cranial or cephalic, right? Then we could do something like, we're doing the foot now, right? So the metatarsals are what to the tarsals? Distal. Remember, on the upper and lower limbs, we're going to do proximal and distal if those 2 points are at different spots from where they articulate. So still on the foot, the fill in the blank, please. The metatarsals are what to the phalanges of the foot? Proximal. Proximal. One more time with the foot. The phalanges are distal to the metatarsals, right? Or the first one I think I did was the tarsals are what to the metatarsals? Proximal. The hallux is medial to its fifth digit. The pollex is lateral to its fifth digit, right? Okay, so don't forget naked person. All right, so now we've got the metatarsals, phalanges. Back to the hand. How many phalanges per hand, please? Keep counting more. 14, right? Why not 15? The pollex only has the proximal and distal phalanx, right? Same thing with the foot. Per foot, there are 14 phalanges. What's a singular form for phalanges would be phalanx, right? So this being the fifth digit, right? What would we call this? The proximal phalanx of the fifth digit. What's this one? Middle phalanx of the fifth digit and the distal phalanx of the fifth digit. On the hallux, right? Big toe. What's this thing? First metatarsal. This would be the what? Proximal phalanx of the first digit and distal. There's no middle on the big toe or on the thumb. Okay. Here's the other question. Okay. So for the lab practical, again next week, I'll set up a mini practice lab practical. But for today, we're finished with all the, no more new materials, what I'm saying, for the first lab exam. It'll be all of the bones. Don't forget to look at the micrographs. I'll go over those with you as well. Here's a question. So I'll give you the foot, and I'll have a sticker all the way across the proximal end of the talus. So here's a sticker. The question is, what articulates across the talus right here? The choices are femur, tibia, fibula, both tibia and fibula. Both tibia and fibula. Both the tib and fib form part of that, the distal, with the ankle joint primarily. Okay? Or conversely, if I were to give you the tibia, so here's the tibia, right? I have a sticker right here. I have a sticker right here on the distal tibia. The question is, what articulates here? The talus. See that on the sticker right here? What articulates here? To the distal tibia, that would be also the talus. Okay, well, that's all I have for you. Sorry I was long-winded again. Again, if you're feeling uncomfortable with the heat, feel free to leave. I'm here till 2, so you got me for a while.
Okay, so can you show me on here what they are? So this is the talus.
So it's turned around this way, right?
Oh.
So yeah, so
I
the
had it upside
talus.
down the whole time.
Yeah. So no, you got it. So
Okay.
it's much easier.
I was wondering that too.
Yeah.
Am I looking at this wrong? I don't get it.
I didn't.
Any
Okay.
anatomical position.
Okay.
So we got the calcaneus.
Okay.
We've got the talus.
Because this looks like it dips
Navicular.
in on the picture. Like, does it? I guess it does dip a little bit.
It has a little bit of a dip, maybe a little bit. It looks like a little saddle,
Okay.
right? And don't forget both tib and fib. I'll get the door if you want to leave early. I'm here till
I was really confused.
I was like, what am I looking
at?
Upside down,
Yeah.
Yeah.
That makes sense. I could hear that. I was like, that little confused.
Yeah. True.
Now it makes sense.
Are you guys gonna like look at it?
Yeah, we're gonna keep looking.
Just for a minute. Okay, so calcaneus, talus, talus. Wait, so she said baby, tiger cubs need MILC. Okay, so talus, calcaneus, navicular, medial, intermediate, lateral, cuboid. Oh my god.
It's gonna be a lot.
A lot. I'm glad it's multiple choice.
Yeah.
But I'm concerned. Yeah, me too. I'm not that confident.
Honestly, every time we go into this now, I'm just like, I actually need to know this for the field I'm going to, and I am a bit concerned because I am so lost. Huh? No, DMI. Diagnostic medical imagery, radiology. Okay. So literally like X-ray.
So you need to know that.
Yeah.
You need to know where everything is.
I'm like
Yeah.
genuinely concerned. I'm like,
Yeah.
this honestly though, like the tarsals, metatarsals stuff, except like literally the tarsals is the part that I'm like the most.
Yeah.
Because I remember metatarsals, phalanges,
Yeah.
and I remember calcaneus for some reason.